This video is to help you learn more about the old public health model and the policies and practices introduced within this model that led to improvements in Australia's health status, particularly from the 1900s. Within this video, we're going to look at each policy and practice in detail that were introduced as part of the old public health model, and then we will look at some questions and making sure that you're aware of exactly what you need to do to meet the criteria of each question and be awarded full marks for this topic. So, in the early 1900s, the leading cause of mortality was from various infectious and parasitic diseases. So, you can see that snippet of information on this slide here from the Australian Institute of Health and Welfare. So, this was a direct result of the environment in which people were surrounded by. So, you can see in these photos that there is a large amount of waste in the streets. We know that rubbish contains large amounts of bacteria. Bacteria is what makes you sick. There was poor ventilation in homes with no windows, so that was leading to respiratory illnesses and more likely for diseases to be transmitted as well. And there was really dirty water to drink and wash yourself in, and that would be water that would be used to prepare food as well. So it's just interesting to look at those images and have a look at, well, that is the physical environment that those people are living in, and no wonder that infectious diseases were a leading cause of death based on their living conditions. So, because of the high amount of deaths, as we could see on the last slide from those particular examples of the physical environment, the government realised that something needed to be done and it needed to be focused on improving that physical environment. So, this is when the old public health model and the policies and practices within this were introduced, with the aim to introduce actions that focused on changing the physical environment to prevent the spread of disease. So they were responding to, we've got all these deaths, they're caused from being transmitted between people, being transmitted through bacteria. We need to bring in some sort of public health that is going to help reduce these deaths. So that's what old public health is. So this is our key skill for this topic. Analyze data that shows improvements in health over time and draw conclusions about reasons for improvements. So this is directly asking us, old public health is an example for these improvements in our life expectancy and mortality over time. So you really need to understand how each policy and practice has led to these improvements. And it's just important to recognize that it's talking about improvements. So we are always going to be talking about from a positive perspective. So the first policy and practice we're going to look at is the establishment of government-funded and water and sewage systems and improved sanitation. So when we're looking at this, there's two sort of elements within this particular policy. So the first is that through the introduction of sewage systems, it provided people with cleaner water to drink, wash, and prepare their food with. So this therefore reduced lots of deaths from infectious diseases such as typhoid, diarrhea, and cholera. So unclean water has a lot of bacteria within that. If you travel to lower income countries around the world, you can still experience drinking unclean water and you'll get sick very, very quickly. So we are very lucky that this was introduced so early for us when lots of countries around the world still have high amounts of bacteria in their water. The other part of this policy is around the improved sanitation part, which was really around the introduction of waste disposal. And this was to remove garbage off the streets. So like looking at those photos before, garbage has high amounts of bacteria. So removing this from the streets helped reduce bacteria and therefore those infectious diseases again, like diarrhea, cholera, and typhoid. So like you saw in the photos, in the early 1900s, there were no garbage trucks like we have today. So just imagine what it would be like to have rubbish all over the streets and all the germs it would contain, the smells that it would have, and just how unhygienic it would be for your overall health. Now, these are the examples that you can use for this policy. You still then need to link to health status. So you could link to mortality, an increase in life expectancy, the prevalence of infectious and parasitic diseases, but we'll look at that a little bit more detail when we do some practice questions together. So this one should be quite easy to remember as we have all lived through quarantine measures throughout the COVID-19 pandemic. But quarantine laws were brought in response to the bubonic plague, which killed thousands of people, and they were brought in to help isolate people when they were sick. So the specific policy that you need to refer to is called the Commonwealth Quarantine Act. So that is going to be super specific and shows you know what you're talking about. And that was in response, like I said, to the bubonic plague, but it was to just keep people isolated, and that prevented the spread of many infectious diseases such as influenza and Spanish flu. Yes, they are respiratory diseases as well. But again, making sure that people were in separate areas and that they weren't contaminating the rest of the public until they were better enough to return to their homes. So, improved food and nutrition. A common error that I have seen when people are using this particular policy slash practice is that people start talking about that people were made aware of healthy foods to eat and to improve their nutrition, which isn't incorrect, but it doesn't directly relate to a disease. So it doesn't really meet the requirements of linking to health status. So it really needs to be around the improvements and safety of the safety and standards and quality of food. Because as you would know, spoiled and unsafe food can lead to many health complications. So foodborne diseases like gastro and diarrhea were highly prevalent in the 1900s due to poor hygiene and food storage. So the specific policy that was brought in is called the Pure Foods Act, and that was brought in 1905, and that was introduced to improve the safety and standards of food. So this included the refrigeration of foods, particularly meats. So in meat, in World War II, there was a rise in stomach cancer because of meat that wasn't being refrigerated. So that was a really big push when this was brought in, and that comes back to the safety and the hygiene of the food as well. And then that led to a reduction in stomach cancer deaths. And then there's just the improvement of food standards overall in terms of people being aware of the hygiene measures that need to put in place around the refrigeration, the storage. It just led to a reduction in foodborne diseases and illnesses overall, so gastro and diarrhea. So again, linking to health status, we are always linking to health status for this particular skill. So thinking about what links you could make there, whether it be mortality, morbidity, life expectancy, prevalence, etc. So our next policy is around the elimination of housing slums and introduction of better quality housing. So when we're looking at the quality of houses, regulations were introduced that required houses to be built with improved ventilation, such as drains and windows. So the fumes back in those days from cooking and other things that they were doing in the house and the smoke were causing people to become very sick because they're inhaling toxic chemicals into their lungs. So having more windows helped increase the airflow in the houses and led to a reduction in respiratory diseases such as asthma. The other aspect is around improved housing standards. So construction companies building houses were made to ensure they were using better planning of their land use, which therefore helped reduce overcrowding. So think about if you lived in a house with lots and lots of people and you had very limited of your own space, and then you're all sharing the same kitchen facilities, you're all sharing the same toilet facilities, that's going to increase your chance of getting sick by a lot. So reducing the overcrowding led to a reduction in infectious diseases like tuberculosis, cholera, typhoid, all of which are highly contagious. So if we go back to the first slide, tuberculosis was really one of the number one killers back in the 1900s. So doing things like this was having a really big impact on that particular infectious disease. So, a few elements to this policy improved working conditions. The first was there was a really early public health action to focus on providing ventilation and toilets in workplaces. Some workplaces didn't have adequate sanitation measures for their workers. So, this policy ensured they had access to clean toilets with ventilation, which helped reduce respiratory diseases and illnesses. It also looked at the protection of workers. So this saw the introduction of child labour laws. So previously, children under 13 were working in really dangerous labourous jobs, which were causing a lot of death. So these laws were brought in. Children under the age of 13 were not able to work, and this saw a reduction in child deaths and injuries. Then we also have the Victorian Health Act in 1919. So this saw regulations be put in place to govern dangerous occupations. So this took form in protective equipment, protective clothing, making sure that work sites were safe, and this therefore contributed to a reduction in workplace injuries. So workplace injuries contributed to high amounts of mortality. So that's a really good health status link that you can use. So the final one we're going to look at is more hygienic birthing practices and antenatal care. So this was really around making sure that mothers had a really safe and clean space and environment to give birth safely in. So this took form in making sure that midwives and doctors were trained appropriately so they could safely deliver children in hygienic conditions, and also making sure that hospital equipment was sterile and hygienic to reduce infection, and again, giving that safe space for mothers to give birth in. This saw a really drastic reduction in both infant, maternal, and child mortality. So back in the 1900s, we still had a significant amount of this. This is very small now due to our advancements in medical technology, how good our healthcare is. But again, if we're looking at around the world, in countries such as Africa or some Asian countries as well, where healthcare may not be as accessible or hygienic and safe, there is still large amounts of maternal, infant, and child mortality. So this has been a really great reduction for us since the 1900s. So let's go through a practice question. Now, for this particular topic, this is quite I guess, a foundation level question. You might also get some stimulus material, like a graph with a particular trend, like it could be an increase in life expectancy, or a particular disease and it's got a trend there, or a table with information and then a question attached to that. That is a really common way that this skill can be presented. But let's just practice this at the more simple level to begin with. So here we've got select 2 policies or practices that were introduced as part of the old public health model and discuss how they contributed to improvements in Australia's health status. So I have broken down in colour codes where the marks are coming from. So you've got a mark for your understanding of the policy or practice. So you really must explain your knowledge of what was actually introduced here. So for example, for improved food and nutrition, like I said on the slide before, if you're just saying that improved food and nutrition meant there were less foodborne diseases, you're not actually going into enough detail about what that policy was, and it's not really showing that you know a lot about that policy. So my example here, it says the old public health model introduced the Pure Foods Act, which brought about improvements in the safety and standard of food. So that is really showing that I know what that policy was in detail. I now need to say, how did that lead to an improvement? So this helped improve hygiene and the safety of food being consumed, which in turn reduced the transmission of foodborne diseases such as bacterial infections, contributing to lower mortality rates in Australia. Now, I've said bacterial infections, you could say gastro, diarrhea. Always give an example when you're giving an example of an infectious disease or a foodborne disease or a respiratory condition, whatever it may be. Give an example to support your answer. So that's going to get me my 2 marks, and now I need to do the same again. So I've chosen more hygienic birthing practices. The old public health model placed emphasis on training midwives and doctors to ensure the birthing process was both safe and hygienic. I now need to say how it contributed to improvements. This was done through ensuring equipment in the environment was clean. This reduced the chance of infections, reducing infant mortality rates in Australia. So hopefully that shows you a really clear color-coded breakdown of where the marks are coming from. On the next slide, we'll go into a little bit more of a complex question that has a stimulus material attached before you practice some by yourself. So here's an example that I just grabbed from the Australian Institute of Health and Welfare, which has some really good graphs in there that you can use to practice. So this is showing infant mortality rates from 1915 to 2020, and we can see that there's a decline. So part A of this question was a data question. Part B, outline one policy or practice introduced by the old public health model that could have accounted for this change. So this makes it that little bit harder because, like I said there with the note, for questions like this, not all the policies and practices can be used. You need to be really smart and strategic with which one that you select. So this one is, I've chosen more hygienic birthing practices because that was just the one that stuck out for me. But there are other ones that you could use if you can justify it. But again, you need to make sure that it's actually relevant to your information. So if you get a question like this and you used working conditions around like child labour laws, that's not going to be an example because that's for children, not for infants. So you have to make sure that your example makes sense. So I won't read through that response. You can read through it. It is actually the same one that I used in the last slide. But that is directly relating to the data for that question. So there will be a couple of practice questions for you to give it a go now. I will have some varying complexities, so an easier question and then working up for a little bit harder as well. So here are two questions to practice. The first one, question one, is one of those, I guess, foundation level questions where there's no stimulus material attached. It's just asking you, it's given you a statement. Death rates from infectious diseases have decreased since the 1900s. Use two policies and practices introduced as part of the old public health model that may have contributed to this reduction. So there's 4 marks there. So you'd need your 2 examples. Make sure you've got enough detail in what your policy or practice actually is, and that you have you're linking to infectious diseases here. You actually don't have to link to health status in that question because it's not asking you to. And then question 2 is you've got that stimulus material attached, and it's around mortality rates from influenza. So it is, again, really important that you are selecting policies or practices that were introduced that is going to be specific to that. So make sure that you select wisely and that you are linking it back to the trend in the graph below. So just to sum up this topic, make sure that you can do the following. So you need to be able to have a really good understanding of each policy and practice. Make sure you know enough detail. Remember, not being basic, you're giving specific names of policies to really show your understanding and show off your knowledge. You are linking to health status, so make sure that you've got your links to mortality, life expectancy, whatever you choose. Remember, to make sure that your examples, if it is a 4 mark or more question, that they're not going to double dip either, where you have a similar response in each, and keep your health status indicators different as well. Know some examples of each disease. So infectious diseases like tuberculosis, typhoid, things like that, respiratory conditions, influenza, asthma. This just really helps strengthen your answer. And I just wanted to add as well, so COVID-19 is absolutely an example of a respiratory condition, but I don't want you to be using that for this particular topic because it's talking about the 1900s. So COVID wasn't around then. It does, I guess, give you an example of what a respiratory condition is, but it is not something that you can use. So I hope this has been helpful for you. If you need anything else, just post in the comments, or and then I can make a video that can help you with whatever help you need.